Welcome to Radiology in a Minute. I'm Sid Dogra, an Associate Editor of Radiology and Training. We'll be discussing generative large language models trained for detecting errors in radiology reports, published by Dr. Kang Sun and colleagues from Weill Cornell Medicine. As we all know, radiology dictations can be prone to various types of errors, ranging from dictation errors to accidental negations. Advancements in large language models make LLMs an appealing approach to detecting errors and have been investigated in a few prior studies, but these have generally explored either a very small number of models or limited types of errors, or have rarely examined the effects of fine-tuning. In this study, the authors explored the effects of fine-tuning LLMs to detect a wider array of common errors that manifest in radiology reports. I'll start by presenting some highlights from the materials and methods. The authors were interested in four types of errors: negation, left versus right laterality mistakes, interval change, and transcription errors. The dataset consisted of two sources. One was purely synthetic chest X-ray reports generated by GPT-4, either error-free or with intentional synthetic errors. The other type of data source was drawn from the MIMIC dataset, using error-free reports or versions with synthetic errors added by GPT-4. Two versions of the Llama 3 model, using 8 billion and 70 billion parameters respectively, were fine-tuned on the training split of this dataset. Biomed-BERT was also fine-tuned and compared, while a version of GPT-4 was used without fine-tuning. The authors also took two models and used them to screen over 55,000 real-world chest X-ray reports, looked at 200 out of 606 reports that were collaboratively flagged as having a mistake, and had two radiologists evaluate them to verify the presence of an error. I'm only going to present a few key results, but again, please do refer to the entire article. The 70 billion parameter version of Llama 3 had the best overall performance across all error types, with an overall F1 score of 0.78, higher than GPT-4 and Biomed-BERT. In real-world validation, 99 of 200 flagged reports had errors agreed on by both radiologists, while 163 of 200 were verified by at least one radiologist. So overall, this study found that fine-tuned LLMs can outperform other models for detecting multiple error types in radiology reports. There's still a lot to improve in exploring this area, as the authors did not look at computational demands of fine-tuning and looked only at chest radiographs.